My name is Dr. Mashonda Smith. I'm the Dean of the Workforce Development and Lifelong Learning Division at the University of the District of Columbia. My impression of the Fit4DC program's progress and its impact is that the team who has received this grant from the U.S. Department of Health and Human Services, ONC division, has worked hard, overcome many challenges to build a training program for healthcare professionals to truly understand the fundamentals and the basics and the importance of utilizing and appropriately utilizing informatics and information technology throughout the healthcare field. So I think our impact so far is off to a great start. I think that we will achieve our goal, if not exceed it. And I think that what we've started here will continue to grow beyond the term of the grant.
My name is Calvin Smith, and I represent Bridgepoint Healthcare, a long-term acute care facility located in Wards 8 and Ward 6 of the District of Columbia. My impression of Fit4DC is that it is a tremendous opportunity for high school graduates, college students, and professionals looking to change careers. It has been a tremendously successful program, and it has been growing each year, adding new cohorts each year. My contribution to Fit4DC has been to pull together a very talented advisory board with over 200 years of experience to help Howard University, University District of Columbia, to think through challenges and opportunities that come their way throughout this program. I believe FIT is a program that should do well and be well for the residents of the District of Columbia. We are mighty pleased to be part of this opportunity, and I look for better things to come.
My name is Luigi LeBlanc. I'm the Vice President of Technology at Zane Networks, LLC. Our contribution to the FIT program is that we provide the technology support services, the learning content management, personnel, and also tools to make sure that the course comes on and is produced well and adequately. I think the FIT program, particularly Fit4DC, is centered around where the workforce needs of the District of Columbia is, in the region in general. It is really focused on building jobs, not just new entries into the market, but those who are upscaling their skills, particularly in an area where the socioeconomical status and the disparities and the inequities are highest in the district. So we're really excited about the future of this program, and I can't stress that enough. We're enthused and pleasantly surprised, though we knew that we hit the mark when we submitted our response for this program, and making sure that this is a participatory program that involves the community. But we're pleasantly surprised at the buy-in from the community, and also the enrollment numbers speaks to it. So it's my understanding that this particular semester's class has 80 participants, and diverse representation between those who are in degree seeking and those who represent the community. We're seeing the partnership not just at the agency level or the district government level. We're seeing that resonate amongst the contractors who are responsible for managing care in the district, and the vendors, the manufacturers of these new technologies that are not just visual data and visual data analytics, but also artificial intelligence. We're seeing that those particular vendors are coming and willing to partner and collaborate with us as well. So that's exciting. I'd just like to conclude by saying that I couldn't be more proud of this team for the work that we've done to put in place a program that reflects the values of the organization and what we intended and our purpose when we responded to this. but also I'm very humbled to be part of the team because the leadership of the two anchor institutions speak well and is accountable to delivering the results that we strive to do and hit the goals as we said we would do under the cooperative agreement.
My name is Antoine Ford, and I'm the president of Enlighten Incorporated, a technology firm located in Ward 8 in Washington, D.C., as well as I chair the Workforce Investment Council of Washington, D.C. Here's my impression of this particular program. The program is necessary. Right now, there's such a gap in folks that are in healthcare, particularly technology. That's my industry. And this program is preparing people for jobs, not only of tomorrow, but jobs of the future. And at this point, what I'm really looking for is the generational types of jobs that this program has created. One of the things I'm big on is getting people hope, getting people opportunities. And we have to address the wealth gap. And getting into this particular industry and getting into this particular program helps address the wealth gap because we're moving beyond just jobs to careers. And that's critically important for the workforce and critically important for technology and healthcare. How have I contributed to this program? I'm a business owner and I chair the Workforce Investment Council for the city. I also work with the Federal City Council. One of the goals for me is to be able to get employers to really look at opportunities to hire people that we're training. And so for me, I try to get outreach, try to reach out to companies and say, we have resources. This program eliminates the excuses of we can't find people in healthcare and technology. We can't find people. Well, for me, this program has allowed us to eliminate that excuse. We can move forward and move. My perspective is how do we go out and find people? That's done. Now how do we find people that are willing to hire people? And this program meets that challenge. The final comment I have is really we want to make sure this is a program that has sustainability. We want to make sure this is a program that is looking beyond just the people that are part of this program, getting people into good jobs, high-paying jobs to be able to afford to live in Washington, D.C. And it has a long-term effect. Not only can they afford what they can do, but they can afford to have their children have opportunities in college, education, housing, some of the gaps we have in this particular city. We have a massive wealth gap in this city where at times the average white family has 81 times the wealth of a black family in Washington, D.C. When you get into healthcare, when you get into technology, these types of jobs help reduce those particular gaps, and we can generationally start to address those things. So I'm proud to serve on the advisory board, and I'm proud to be a part of what we're trying to do.